Hi, I'm Stephanie Lemick, and this is the Building Trauma Informed Workplaces podcast. I am so excited for today's guest. She is absolutely one of my favorite people, and she is freaking brilliant when it comes to talking about the workplace and talking about mental health and well-being in the workplace. My friend Colleen Saringer, she has a PhD, y'all, so we're going to have some real knowledge dropped on us today, is here to chat with us about the social determinants of health. And I always love to let people introduce themselves. So I will turn it over to Colleen. Colleen, welcome. We'd love to hear more about you.
Well, I'm just going to carry you around with me and make you introduce me everywhere because that was the best.
It's all true too. Makes it easy.
Well, thank you. So I'll just pepper in a couple of other things because in all reality, you did a great job. So thank you very much for that intro.
Of course.
But so yeah, I've spent 25 years working in the workplace. A lot of it has been sat at the table of a diverse group of clients, a very diverse, kind of book of business. But that 25 years has all been spent trying to help organizations, large and small, understand how do we really make an impact on culture, which impacts mental health, which impacts the human, all the things in the workplace through the lens of health and well-being. So that's the only other thing I would add. And thank you again for calling out my nerdy PhD. I appreciate it.
Heck yeah. If I had a PhD, I would tattoo it on my forehead. I'd be like, Dr. Lemick. So yes, I absolutely so incredible the work you've done. And I have to give a personal shout out and just speak to, who you are as a person. Colleen is one of the first people who encouraged me to push forward with the wounded workforce and said, you know more than you think you know. This is a topic that's so important. You're so passionate about it. Go. And so we wouldn't be having this conversation or this podcast if not for Colleen. So grateful to finally have you here on the podcast. You've joined us for several panels and you always have great insights. And I know this conversation we're going to have today stems from, something you brought up on one of the panels. And I was like, ooh, I want to talk more about that. And it's the concept of social determinants of health. I told you before we jumped on, I know so little about this concept. So I am ready and excited to join our listeners today in learning more about, what social determinants of health are and how we can think about them when we approach workplace well-being.
Yeah, absolutely. It is literally one of my favorite topics. It's like something that I totally nerd out on. And so I can't wait to share it with you. So yeah, and you're right. I actually had to go back a little bit in my brain file. And it was when we were talking about safety, holistic safety, right? On one of your trauma-informed panels. So yeah, that's right. Peppered this love in.
Absolutely. I think that was the original panel too.
Yes,
see, Colleen is an OG, a trauma-informed OG. I love it. Perfect. So if you would share with us, so we could all start, me, I love to start from a place of shared understanding.
Absolutely.
How would you explain or define the concept of social determinants?
Social determinants of health, what brought me great joy about this term is that I would say around the pandemic, that's when it started to become a hotter topic in the workplace, okay? And it pains me a little bit to say hot because social determinants of health is not new. In the public health world, we have used this term. It is a term that is always used. Anything from a community standpoint, it is thought about. Literally, we cannot do anything in community fashion or form without thinking of social determinants of health. And so all that to say, it found its way into the workplace because if we think about what the workplace is, it is a community, right? And so for any organization, any listener that works in a workplace that may be listening, I would say this, that if you are going to focus on the employee, regardless of the lens at which you're going to come at it, whether it be trauma, whether it be culture, whether it be health and well-being, social determinants of health is always going to be at play, okay? So then, of course, the big question is, what is it? So first I'll give the nerdy definition and then I'll go into a visual definition, right?
Perfect.
So first, the nerdy definition is social determinants of health is a collective group of factors that plays the largest role in the overall health of a person. Okay, now remember that, the largest role, because that's going to play a big kind of component as we go forward. All right, so now what I want to do, we did the nerdy definition. Now let's talk about it from a visual, because I think this is a little bit easier.
Sure.
I hope it's a little bit easier. At least it is for me. I'm hoping it resonates. So if you think about your human body, so your human body, my body, you know, those that are listening, and let's say our body represents the number 100, so 100%, okay? So now we're going to section off 50% of the body, okay? And if we need a visual, I would say think about it from the waist up. And so now, again, we're still talking about social determinants of health and the largest kind of factors, right? So if we think about that 50% as our visual, this list of factors that I'm about to share are what have the most impact on a person's health. So these factors are a person's income, whether it be individual or family, their education, their employment or occupation, the workplace. So that's where we have sub things like culture, climate, leadership policies, right? Where an individual lives, the safety of where they live, their ethnicity, their religion, family support, how clean their air is where they live, is their water safe to drink where they live, if they live in and can afford housing, and if they have transportation. So that list is what impacts the majority of a person's health. Okay. So now you're looking a little, because for those of us that can't see us, Stephanie and I are actually on video. So she looks a little mind blown. So do you want
my mind is blown. My mind is blown. I mean,
so I'm going to take it into like an example, because a lot start to scratch their heads and they start to say, you're crazy. Lady, you are crazy. PhD, throw it out the window. You're nuts. Because we immediately go to what? We immediately go to nutrition, physical activity, tobacco, lack of sleep, alcohol. We go to the behavior.
right.
So if we were to talk, I'm going to kind of keep going on this thread for a second. So we go to those behaviors. In reality, nutrition, physical activity, smoking, those things actually only influence 20% of a person's health. Yep. So 50, 60, we're at 70, right? The next 20 is access to care. Okay. And then the last 10 is genetics. Mind blown, right? And I'll definitely back up and give 2 examples of how it plays out, but I want to pause for a second.
My mind is so blown. Like, I'm gonna have to post like some video clips of like Colleen blowing my mind. This is I so want these examples, but I have so many follow-up questions, because this is just like turning everything we are constantly told about health and behavior, specifically healthy behaviors, on its head. So I'm so intrigued and definitely want to dive in more, but I'll let you get to your examples first before I start peppering you with questions.
Okay. All right, let me give you 2. And I can definitely throw out more, but I'll give you 2. So for the warm-up one, we'll do nutrition, because I feel like that's like a place we can all wrap our arms around, right? Okay, so let's keep it in the context of the workplace. Okay, so typically we say, hey, employees, we're going to have this nutrition challenge. Eat your fruits and vegetables, drink your water. Here's a flyer, yada, 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 right? In order for that employee to actually change their behavior with this nutrition challenge, let's go back to those social determinants of health factors, right? They needed the upbringing in a household where fruits and vegetables were encouraged and even supported, and also made a priority, right? So that takes us back to culture, takes us back to social support. So it takes us back to family, right? Ethnicity, my religion, right? How were fruits and vegetables even presented to me? Do I even know what cauliflower is? Maybe I've never even seen cauliflower, but we're immediately thinking, eat your fruits and vegetables, right? We're going straight to the behavior, not to what's behind the behavior. Okay. Now let's go to income. Again, eat your fruits and vegetables. Okay, cool. Well, I needed to be brought up in a household that could afford fruits and vegetables, right? I also needed access to a reliable food source. So not my convenience store, right? I mean, I can continue to play that out and say reliable access is not just a quote unquote proper grocery store. Again, not convenient, but did I have to take the bus to get there? Do I have transportation to get there? Right? So again, in the workplace, we go straight to eat your fruits and vegetables. It's that easy. Why are they not? Why is BMI so high? Why do we have high blood pressure? We are forgetting all the things that are actually influencing the behavior.
I love this one because I'm going to call myself out. I'm a picky eater. And I
Okay.
used to be a super picky eater when I was growing up, when I was a kid. And I grew up in Omaha, Nebraska,
Yep.
not known for its produce other than corn and soybeans. And I moved to Arizona about 11 years ago now. And I remember, like, I have photos I took of salads I made when I first moved to Arizona because the produce is so different. It
Mhm.
is so fresh. There's so much available that's organic. It's big. It's relatively inexpensive because of location, because of proximity. So now when I go back to Nebraska and someone's like serving up a salad and it's filled with iceberg lettuce, I'm like,
Yeah.
no, Stephanie wants some arugula. Like it's
Yeah.
this thing. And so for me, I love what you're saying because I grew up with a lot of canned and frozen vegetables, which I am not a canned vegetable gal.
Yeah.
I'll just leave it at that. But for me, so I didn't like vegetables. And so I always thought, oh, I don't like vegetables. I didn't like the vegetables that were available to me because they weren't fresh. They weren't like the variety wasn't there. And again, yes, I am still being a little bit picky, but just by changing location, my behavior changed wildly. So it's so interesting. Like that's so perfect. It's such a great example because we
Yeah.
do. We say eat your fruits and vegetables. Well, I have a very different opportunity to eat my fruits and vegetables in Arizona than maybe someone in the Midwest. Or again, looking at income levels and access to a supermarket. We talk about, I know we talk a lot about food deserts.
Yeah.
So interesting. What a great example.
Yeah, thank you. I figured that would be like not an easy one, but one that we could wrap our arms around and maybe
Relate to, yeah.
yeah. And I love that you have this personal story to go
Mhm.
along with it because like you literally summarized it perfectly with your story.
Every once in a while, Colleen. You said you had two, so I want to hear
Right.
the second example. I'm loving this.
Let me give you the workplace, of course, because
Perfect.
I feel like it was, I'm going to get my years off, but maybe it could have been the pandemic. It could have been pre-pandemic when finally the workplace was put under that list of that 50% back, with income, all the things we've been talking about, because workplace wasn't there before, but it is now. Thank goodness. Because I do think this is why it's helped us kind of put an even greater spotlight on the mental health stuff. But so all that to say, we've got to use a workplace one. And so the way that this plays out is this one's a little bit shorter because I feel like we're going to all resonate in some fashion with this. I have a manager or leader who is a micromanager and they are just downright nasty. Okay. Now I'll use myself for this. What I learned from my baby boomer parents, so cultural norms, social, right? My upbringing, all these things, is that I'm supposed to put my head down. I'm supposed to keep quiet and I need to keep my job because I have to pay my bills. Okay, so that's that 50%, right? Now, what does this do? This exacerbates my stress. I sacrifice my time for physical activity in order to work more. What happens to my weight? What happens to my heart? What happens to my sleep? All those things are now impacting behavior. So that's why it's so important that we wrap our arms around leadership and policies. And when I say policy, I'm talking positive policies, like giving people time during the workday to move and not penalizing them, right?
Yes.
Yeah, like I'm
Yeah,
talking positive. And so that's like all those things are a mental health influence. And so that's the second example that I would give. Like I said, I feel like that's an easy one because I think we've all probably been there in some fashion.
absolutely. I mean, one of my favorite questions back when I was in-house doing lots of interviews, one of my favorite questions to ask was always, tell me about your favorite manager, your best manager you ever worked for. Why? And then I would follow it up and I'd say, tell me about your least favorite. Like, you
Mm-hmm.
don't have to name names, but tell me about that least favorite manager.
Mm-hmm.
Everyone had one. We all have one. It's
Yeah.
okay. And
Yeah.
sometimes it's a bad match. And sometimes it is something where that person's management style, leadership style, the organizational culture is causing you mental distress, mental health issues, sometimes even trauma. And it's
Mhm.
so tough because I think what I love when we get together and chat, Colleen, is I think we're both very interested in like the individual micro level and then the macro level.
Yeah.
And there's so many managers who I really think want to be doing the right thing. They want to be good managers, they want to support their teams. And I think two really common things happened. Those managers never received this training, tools, support, resources to be a good leader, to be a good manager,
Yep.
and or they are also overwhelmed with work. I don't know. I think I've had one manager my whole career whose job was only to manage.
Yeah.
Shout out Gallup.
Yeah.
Their job was only to manage. They did not
Interesting.
have like tactical
Mm-hmm.
workload they were responsible for doing. And I so often see, and I'm sure you have too, people will be doing a job and then promoted to manager. And so they're managing a team and now also doing the job, at
Yeah.
least in some portion. And so it's so hard because we pick on managers a lot, and rightly so, because they do have an outsized impact. But I also think kind of that macro pullback is I want to pick on organizations for not doing the work of actually resourcing, supporting, training managers to do right by their teams
I
and
agree.
holding them accountable for that as well.
100%. I totally agree. I mean, gosh, for years we've been talking to organizations about, in some fashion, how do we integrate this into performance reviews? And the pushback, you would think that, gosh, I don't want to say this, I don't want to insult, but you would think like somebody asked me to donate a kidney or something
Yeah.
without, like knowing the person that I was donating to. And no, it's just really like, let's hold our feet to the fire to actually
Right.
make change happen. Other than that, it's just not going to work.
It won't work.
Grassroots
Yeah,
change doesn't happen in
absolutely.
workplaces where it's broken. It just doesn't happen.
I agree. And I think too, I'm like excited about Gen Z. And one of the reasons I'm super excited about Gen Z, other than having fantastic Gen Z stepdaughters, is that Gen Z is really kind of taking a very different approach than I feel millennials took to the
Yeah.
workplace. And that they're like, they've seen a lot of what millennials did, and it didn't work out for us in terms of,
Mhm.
taking on like significant student loan burdens, going into the workplace and buying into kind of the hustle, the climb the corporate ladder, do all the things. Like you said, put your head down and work.
Mhm.
And they're rejecting that in a really interesting way, in a very, broad brush way. And, not that any generation is superior to the other, we're all just different. I think this rejection of kind of the status quo being such a hallmark of an entire generation when it comes to the workplace, I think it's such a great moment to really create meaningful change when it comes to how we approach work.
I totally agree. I have this conversation a lot. I worry. I worry about the talent pool. And not just from the number of people in it, but
Right.
also like the people that can actually like do the job, right? I mean, at the end of the day, there's some jobs that we just can't do, right? And there's some jobs
Right.
that others do and blah blah blah. So there's definitely like things about that, but this generation, and again, I'm with you. They are helping make change happen. I worry that when again, back to that comment about the talent pool, they have found so many other ways to make a living, and they have so many other ways to make a living today. I don't know how many of them are going to jump into that pool to say, oh yeah, I want to go work in the context of these crappy four walls.
Right.
And so
100%.
we've got to make this change. We have
Yes.
to.
It's necessary. It's so funny. I so frequently talk to people in this space, and we're all like talking about the thing we all know, and somehow everyone else isn't talking about it. In that, just from a demographic standpoint, baby boomers retiring will create a huge, loss of talent that we
Yeah.
need to fill roles. And, AI, people talk about AI taking jobs. I'm like, no, thank God. AI will help supplement because we don't have enough people to fill all of these jobs.
Right.
Um, it's so interesting to me. And I think you're right. I think without significant change, Gen Z is like, I'm good.
Yeah.
Peace out. Like, we'll
Exactly.
find new ways to create our livelihoods. And oh, by the way, like, the jig's a little up. Like, we don't anticipate that, if we follow these steps X, Y, and Z, that we'll have this amazing career, amazing life, because we just watch millennials
Yeah.
do that and have a wide variety of results.
Yes. Yes. Gosh, I feel like we can even go down the whole thing about income
Oh,
and the
yes.
cost of living and how the increase needs to be higher based on where just
Mhm.
income in general is. So I think even that, right? I
Mhm.
think I think they're tuning into that fact too. Like, so I'm guaranteed a 2%, maybe 3% raise. I can't even afford to pay my apartment bill, let
Right.
alone, right? So I just it's an interesting conversation, and it's got to continue so that we can get that change going. And again, I'm with you. They are going to help us change, and I'm so thankful. So thankful.
Absolutely.
Yeah.
I love a change catalyst.
Yeah.
So we're
Yes.
giving Gen Z credit for that.
Heck yeah, we are. And for other things too.
Of course, of course. I don't know about their genes, but whatever. Old side part and skinny jeans over here, can't take that away from me. Um, so I mean, back to social determinants of health more directly, one of my first questions, I think, amazing definition and overview, by the way. Thank you very much. I'm like you saw, my mind is blown. Some of the social determinants of health seem really obvious. Like, of course, the quality of your air and drinking water would have an impact on your health. But other ones are kind of like, oh, really? Like, how does your religion play into your health? Like, how does that factor in? And, I don't know if you have all the answers to this question. It's quite a broad question. How are these social determinants well determined?
Much smarter people than me from long ago.
So
I
it's research based,
Yeah,
right? Like,
it's
yeah.
totally evidence-based research. So yes, so that's literally why I'm the public health world. I mean, to me, when I think about what playbook can we take a page out of,
Mhm.
it's the public health world, because at the end of the day, the way that the way that we are informed from research from a public health standpoint, we are just we are we are part of the public health that just happen to be working inside a company.
Right.
We are the data, right? Like we are. So when companies ask me like, oh, well, what does our data say? It doesn't matter. Your people are the data in the public health world. Like we don't need any more data. It's all there. So it's just go to the CDC's website. It's all there.
It's all there.
Yeah.
I love
So,
that. No,
yeah.
everyone always wants more data, but I mean, it's a great point. Like, your community you're working in, like your company is operating in, most of the time, hopefully, your employee base is also part of that community.
Yeah.
And so they are, at least to some extent, again, we hope, representative of that community.
Yeah.
And so those factors you're referencing, we should
Yeah.
have a little bit of a baseline of understanding.
Yeah.
I love that.
Because, a lot of organizations, they'll say, I mean, well, I can't change my community. No, that's okay. We're not asking you to change the community. There's definitely other like ESG factors and things like that
Mhm.
are, again, kind of coming into play, which is fantastic. But there are things that you can do in the context of your workplace to influence or hopefully close the gaps of what happens when I go home to my community. So let me give you another example, which I know you've heard me say before, but I'll share it for those that are listening. I live in Atlanta, Georgia, and I live in a pretty transitional neighborhood. I did not move into this neighborhood 19 years ago with safety. I did not stop at red lights going to the gym. I did not, I sped through all of them. I also did not have sidewalks to walk on, right?
Oh, wow.
Right? Like, because it was that transitional, right? So think about that. And now think about, what could my workplace do when they're saying, hey, we have a physical activity challenge. And I'm saying, good for you. If you're not going to give me time during my workday, I sure as heck can't go home and go for a walk.
Right.
So that's how that plays out. I'm not asking for my job to put sidewalks in my neighborhood, right? But the way they can close that gap is say, okay, now how can we bring this and close this gap at the workplace? That's how we leverage and integrate social determinants of health in changing behavior.
I love that, because I think it's such a great connection you've made, that we aren't saying to address social determinants of health at the workplace level that you have to go and like change communities. I mean, if you want to, sure, that's great. Like if you want to give back to your community, absolutely, full proponents of that. I think though, it's so great that you are saying we can still improve an employee's health. Maybe they don't have access to a sidewalk to go for a walk after work. Maybe they don't have time after work. Maybe they're a single parent, or they have other obligations. All of those factors, a wide variety of different, lifestyles, components of our lives lead back to something that I'm super passionate about talking about, which is flexibility. And I think sometimes the really important conversations that we need to have about flexibility get drowned out by the conversation of remote or in-person work, which is a component of flexibility. But when we just talk about flexibility in that context, I think we forget about a lot of things and a lot of ways we can address a larger population of the workforce. So folks who are actually doing work that has to physically be done in person, they deserve and need flexibility as well. And so I love that, because to me, what I'm hearing is we can address and give opportunity to, Colleen wants to work out, wants to participate in the company steps challenge. How can we make sure she has access to do that in the workplace, or by providing, maybe it's access to a gym on location, or recommend like time during the workplace to go on walks, or different things, but options and flexibility. And I mean, one thing I talk about all the time as it relates to being trauma informed is creating choice. So creating choice, creating options, to me is kind of that key to really creating flexibility that's meaningful.
And that's that's exactly what it is. It's giving choice and removing the barriers, period.
Yeah, absolutely.
You don't need to put more barriers in place. It's hard enough.
So if someone wanted to be more thoughtful about, the social determinants of health as they're approaching, the workplace, benefits programs, wellness planning and strategy in their organization, where would you recommend they start? Or what are your kind of pieces of advice you would offer them?
I think, again, the data, right? Everyone is so focused on data. And when, again, I go back to the public health world, we have a database that's at our fingertips. And a lot of, depending if you're working with a consulting firm or whoever the case may be, this is available for anyone to gain access to. I would highly recommend understanding who your population really is. In other words, what zip codes do they live in? What is the health of those zip codes? Because if you live, again, I'll use my zip code 30318. It is a zip code that has extremely poor transportation. It has poor walkability. It has poor mammography rates. Things that, yes, you can get with in your medical plan or whatever the case may be, but this just speaks to the community in which I live because I spend a lot of time here and it influences me. So all that to say, if I'm a workplace, I want to understand, where do my employees live? I want to like pull out some key components. I mentioned a few: mammography, walkability. These are all things that are on like county health data websites.
I'm thinking, just for example, though, so, oftentimes we see organizations, have awareness or different outreach, different resources available around breast cancer awareness or, heart health.
Mm-hmm.
Think about how much more impactful those initiatives could be for the overall health and well-being of your organization if you actually understood what's going on in that population at
Yeah.
a, like you said, community level. So like
Yeah.
you said, if you're operating in a community where mammography rates are low, maybe an awareness campaign and understanding around when, what, how often you should
Yeah.
be having a mammogram, ensuring access to that would be better than any other, specific initiative around preventing breast
Yes.
cancer or, any other kind of preventative care. So I think you can get really focused and really specific. And I know I've been in so many different HRIS systems. Y'all have zip codes of your employees.
Yes.
So really the lift to access the data, yeah, you're going to have to go out to an external website, county data, CDC data, and look at that information. But like you said, Colleen, the data's all there. It's really at our fingertips.
Yeah.
And I know HR professionals, sometimes we get, hey, we want to see the, ROI, we want to see the data, we want to understand the information. So when you're looking at building business cases around wellness initiative, healthcare initiatives, mental health care initiatives in your organization. I mean, Colleen just gave us the most amazing tip here. Take your zip codes and then go get that county data, go get the CDC data, and you have a whole bunch of community information related to healthcare. And you didn't have to go and do a whole bunch of additional work and surveying. Also, you didn't weird out all your employees by asking them personal health
Right.
information, which is
Exactly.
really important. So I love,
Exactly.
this is such a great hack, Colleen. Like, even beyond this, I'm like excited.
And of course, as you're talking, I remembered the third thing I was going to say,
Perfect.
which is income. We forget, like, we look at the average, right? We
Mhm.
got to really look at, with that, now within those zip codes, what's the average income? Because based on if I'm in a rural area, an urban area, I promise you, the zip codes or the income is going to line up. And so that too is then going to influence, even taking it all the way back to the mammography campaign, right?
Yeah.
All of those things play a factor. So I'll even round it out with your idea with the mammography campaign is then now take it one step further and find the radiology centers in the area, call them and host a company screening day, whatever. You're not really hosting anything. You're just like
Yeah.
kind of doing private appointments or whatever the case may be. Give them the choice and remove the barrier.
Remove the barriers. Yeah. Oh my gosh. It's so like,
Yeah.
I am again. I guess I'm calling myself out on the episode. I don't know what that's about here today, but we're here for it. I guess I'm super bad about, like, I'm really good at taking care of other people when it comes to like proactive care, like healthcare. This is probably a very common thing for a lot of women, working women, I would imagine. I'm really good about trying to be proactive for others. Like my dog's vet's appointment, everything's ready to go. But like for my own, I'm like, just like, oh, I have to find a new primary care doctor. I don't want to do that. This is just so overwhelming. And then months go by and it hasn't gotten done. So it's like you said, as simple as removing some of those barriers when it is something where you're wanting to make a concerted effort to, have folks get screened, it can be hugely helpful. And sometimes all it takes is an hour to find those providers and then set aside dates and times.
Yeah.
And so like that's where I think it's amazing, because a lot of times we talk about, oh, lack of budget, lack of resources. When you're doing the right things and focused in the right areas, you can have a pretty outsized impact without a lot of budget. Not to say we don't need to budget for wellness and health initiatives. Absolutely, we do and we should. But I know sometimes folks are in a bind and they want to support the employees, the communities they're part of.
Mhm.
This is a great way to be able to do that.
Yeah, exactly. And to your point, yes, things need a budget, but the things that we talked about really don't.
Right, right.
They
I
need a
love that.
body to get it rolling and doing it. That's it. It's
I
already in your
love it.
budget because you already have the person working there.
Amazing.
Yeah.
So perfect. Well, Colleen, this has been so interesting. I'm like my head is still spinning. This is so informative, and I like all the different ways folks can use this within their workplace is so interesting to me. I also know you're the expert. So, and we're lucky enough to have you offering consulting services. So I
Yeah,
want to make sure and
for
give
sure.
some time so
Yeah.
you can share with our listeners, a little more about the work you do around consulting. And then if they're interested in learning more or partnering with you, where they can reach out or learn more.
Yeah, no, I really appreciate that. So yeah, so I gave a plug for other consultants, but I should probably give one for myself.
Yeah.
Don't call them, call me. So yeah, so the work, this work can be a heavy lift. I
Yeah.
respect that. And going back to the whole thing about budget, the way that I'm positioning myself is yes, as a consultant, but I really want to roll up my sleeves and help organizations get this work done, which is where the other opportunity to work with me is through fractional services.
Wow.
I know how to do it. I mean, this stuff
Yeah.
is like on my tongue and just kind of flies out, right? I mean, I live and breathe health and well-being in the workplace. And so I offer the fractional services. I can sit at your table with that leadership, lens, but I can also help you get the work done as well. Or I can serve as a consultant and come with the information. And then of course you have to kind of take it and run with it yourself. But right now, where I can be found is you can reach out to me just directly on LinkedIn. Website coming soon, but I'm up and running on LinkedIn. You can find a lovely message from me on a day-to-day basis there.
Amazing. Yes, we love your content on LinkedIn, Colleen. And I will say, there's a lot of people doing a lot of great work in the fractional space. Colleen is the only person I know doing specifically fractional work focused on health, wellness, well-being. And I love it because it makes so much sense. She knows I love it. It makes so much sense because, I spent 16 years in-house in HR. And if I had a partner like Colleen to help me not only just like give me the data, but help me navigate and create understanding and make those connections, think of how much impact your wellness budget, your healthcare budget could have when you have an expert in place to really focus on the right things and help navigate that. It's like a superpower. And we all know, we already talked about Gen Z on this podcast, but we know how important health, mental health, well-being is going to be as a differentiator for employers now and well into the future. So I'm a huge fan of Colleen's work and happy to, if anyone has any questions, always happy to connect you directly to Colleen, myself as well.
Thank you so much. It was such an honor to be on with you today. I appreciate it.
Absolutely. This was so amazing, so informative. I don't know that my mind's ever been this blown on the podcast. So congratulations. I'm sure we will have you back to chat about a whole host of other things. You're like our resident expert. So I appreciate you coming and sharing your knowledge as always. And listeners, thank you again for joining us. Until next time, be well.